You're watching George Washington University Health TV, a service of George Washington University Hospital and the Patient Channel.
I never wanted to be an athlete. I never wanted to run a big old marathon. I never wanted to be this strong, athletic woman. What I wanted was to be healthy. I knew if I did not make a change, I was gonna die. My mother and my grandmother died as a result of having type 2 diabetes. I had a flashback. 5 years ago, I found out I was diagnosed with type 2 diabetes. I used food as a way to cope. So I just looked up one day and I was over 200 pounds, almost 300 pounds.
Although results vary from patient to patient following bariatric surgery, Wanda is a perfect example. She went through our comprehensive program at George Washington University Hospital, and now her diabetes type 2 is in remission and her hypertension is resolved.
Now I can get into one pant leg. Walking became my best friend. Even when I was in the hospital, I think it was maybe a day after I had the surgery, I was up and walking that floor in that hospital. I believe GW Bariatric Program saved my life.
In one of the world's most powerful cities, one hospital stands strong, the George Washington University Hospital. In an instant, knowledge and expertise unite. These moments define us as a hospital, as a community. Trusted by our neighbors in DC, Maryland, and Virginia, we set the highest standards for clinical and academic expertise, solving complex medical problems, perfecting innovative surgery, delivering the future. GW Hospital, defining medicine.
You're watching George Washington University Health TV, a service of George Washington University Hospital and the Patient Channel.
To achieve excellence requires knowledge, passion, vision. Already the region's authority for minimally invasive and robotic surgery, surgeons at the George Washington University Hospital are now advancing single incision procedures, expertly performing gallbladder, colon surgery, hysterectomies, and more through a tiny incision in the belly button. Less pain, faster recovery for our patients. GW Hospital, defining medicine.
If you've recently had surgery, chances are you have an incision, which is held together by stitches, staples, tape, or tissue glue. We're going to show you some simple steps to take care of your wound and yourself after surgery. My friend and I will give you some pointers for preventing infections, caring for your wound or incision, and taking care of yourself after surgery. Check your wound every day to see if it's red, hard, or particularly warm. Look at the discharge, the liquid around the wound, and notice if it changes color. Green or yellow may be an early sign of infection. Watch for any increase in the amount of discharge or bleeding around the wound. And if the size of your incision gets bigger, you're in more pain than usual, or if you're running a temperature, it's time to call the doctor or nurse.
Honey, don't forget.
If you're 40 or older, schedule your annual prostate exam. A simple blood test and quick physical exam are all it takes. The George Washington University Cancer Institute offers free appointments on Fridays. Call 202-741-3106 because a prostate exam could save your life. Call 202-741-3106 today.
Every year in the United States, more people die from hospital-acquired infections than from breast cancer, car accidents, and AIDS combined. So it's important to know how to protect yourself while in the hospital.
Hands are the main way that we move bacteria from one place to another. And that's why hand washing is so important. If we do a good job of washing our hands, we can break the chain of transmission. We can stop carrying bacteria from one place to the next.
The information contained on this channel is intended to make you a better informed patient. It is not a substitute for professional medical advice, diagnosis, or treatment. This information alone is not to be relied upon to determine the proper course of treatment. You should not modify, change, or discontinue any treatment in any way without first consulting your physician or healthcare provider. Neither the Wellness Network nor this hospital, its affiliates, or staff shall have any liability to any person relating to the use or accuracy of the content. This channel is supported by product advertisements. The facility airing this channel and its affiliates and staff do not necessarily endorse or have any financial interest in the products advertised.